Madam President.
Senator from Louisiana.
Madam President, I'm going to speak about the Drug Affordability Act, what people in Washington call the Grassley-Wyden bill. I'm renaming that bill. I'm going to rename that bill to what I call the Making Coronavirus Affordable Act, Coronavirus Medicines Affordable Act. And I want to address drug affordability from the perspective of coronavirus and address it from the perspective of a physician. First, people ask, how is this different than regular flu? 10,000 people die a year from flu. Why is this so different from that? Well, again, as a physician, let me speak to that. Each of us, however old we are, have been exposed to flu either by the flu vaccine or a flu infection as many years as we have been alive. So when someone is exposed to the flu, they have a whole kind of armamentarium of antibodies. And when the flu virus comes into your body, those antibodies mobilize, and it's not an exact fit to block the effect of the flu virus, but it's a pretty good fit. And so an infection which otherwise might cause problems, the effect is blunted, and the symptoms are either absent or minimized. As it turns out, the flu virus kills the very young, who've never before been exposed to the flu virus before, or the very old, whose immune systems are no longer working as well, and even though they've been previously exposed, their body is more vulnerable. Now, coronavirus, nobody's body has ever seen before. For everyone, this is a brand new infection, and there is not a library book of immunologic responses that enable us to fight back against this virus. For all of us, if you will, it is a sucker punch to our health. We turn around, boom, it hits us. Now, in terms of who it can kill, again, it seems to cause problems in newborns, the very young, but it also causes problems not just in the very old, but the older, but not so very old. In China, we've learned that if someone is over 50 and they have an underlying medical condition, they are at increased risk. If you're over 60, you're at even more risk. So unlike influenza, where typically the person who dies would be 75 or 80 and in a nursing home, in the terms of coronavirus, it might be somebody with high blood pressure or diabetes, heart disease, cancer, or lung disease, who's otherwise living life, walking around the streets. They get hit with this virus, and all of a sudden they have a problem. Now, we're going to find a cure. Sooner or later, we will come up with medicines that help somebody who's infected get well. The question is, will those medicines be available to you? That's what we need to be concerned about, Madam President. So what does it mean? Well, first, there's been reports that both because of the infection raging through China and a decision by India, that it's possible that some of these drugs will not be available. In China, they make the raw ingredients that is shipped to India, and they make the medicines. Well, China's not producing as many of the raw ingredients, and India has put an embargo on the export of some of those drugs to the United States. At least on the drugs they've embargoed that I saw a list of recently, none of those medicines are medicines that we think might ultimately help fight coronavirus. So even though we have a problem with supply chain, I don't think it's going, so far, there's no evidence it will impact the ability of a medication, whenever it is discovered, to be available to here in the U.S. But there is another issue. Can the senior citizen who is most vulnerable afford the medicine? Let me put this up. Under the current structure of Medicare Part D, the senior citizen, the person on Medicare Part D, pays a certain amount of money until they go into the so-called catastrophic coverage phase. Now, pharmaceutical manufacturers and pharmacy benefit managers manipulate that list price to more quickly move the senior citizen into her catastrophic phase. And when she is in her catastrophic phase of her Medicare Part D benefit, she must pay 5% of whatever the price that drug, of whatever is the price of that drug, even, imagine this, if that drug cost $1 million a year, she would have to pay 5% of it under the current structure of the Medicare Part D benefit. I just posted a video on my Facebook page, and an oncology nurse, Kathy at East Jefferson Hospital in New Orleans, or Jefferson Parish, was speaking about how this benefit design, where the senior has to pay 5% no matter the cost, is so harmful in terms of her ability to get certain cancer drugs to cancer patients. Now imagine it is a coronavirus drug. A cure for coronavirus, we know it's going to eventually be here, and it can be priced, you name the price, we're going to pay it. Or can we? Can someone afford 5% of $100,000? Or 5% of $50,000? Is it imaginable that such a medication would be priced as such? It is totally imaginable. We need to enact what the chairman of the committee calls the Grassley-Wyden bill, but which I call the Making Coronavirus Drugs Affordable Act. What we would do with this bill is change the Part D benefit so that when a senior pays up to a certain amount, period, it's stopped. She or he pays no more. And no matter how much that coronavirus drug is priced, she or he will not pay above a certain amount. If they price it at $100,000, under current law, you're paying 5% of that. Under this law, you would not. The out-of-pocket exposure, if you will, is capped. By the way, it also caps it for the taxpayer, which saves you and me as taxpayers, all of us as taxpayers, a heck of a lot of money as we attempt to balance the federal budget and as we attempt to preserve the life of the Medicare program. So I will point out, we're going to have a cure for coronavirus sooner or later. But if a senior citizen or anyone cannot afford that cure, it is as if the cure had never been invented. We need both for the cure to be invented, but we also need for it to be affordable, or otherwise it would not be available. By the way, somebody may tell you they're supporting another bill, either in the House of Representatives or here in the Senate. This is the only bill out there which is bipartisan. This is the only bill out there which has a chance to pass. This is the only bill that can protect senior citizens not only by being good policy, but by being signed into law by the President of the United States. And the President of the United States has signaled that he indeed would sign this law. Now, the Making Coronavirus Drug Affordable Act does other things as well. It caps out-of-pocket expenses. It lets patients pay over time. If they know they're going to have a big amount in January, they don't have to pay it all in January. They can pay it a little bit in January, February, March, all the way through the end of the year. It protects patients from price gouging, but it still preserves incentives for these cures to be invented. Madam President, as we look for a holistic response to the coronavirus infection, we must keep in mind that drugs have to be affordable. And so I'm asking all my fellow senators to support the Making Coronavirus Drugs Affordable Act, also known as the Grassley-Wyden bill, and for Senator McConnell to bring it to the floor. And with that, I introduce my colleague from Montana, Steve Daines, to continue this discussion. Senator Daines.